Hello, today I'm going to talk about the forehead bone reduction surgery, which is one of the most important procedures in facial feminization surgery for transforming a masculine face into a feminine one. The concept of facial feminization surgery is to achieve a complete transformation so that after surgery, the patient looks naturally feminine and no one can tell that she was ever male. One of the most significant masculine features on the face is the brownish bone. If you look at the skull model, it's the bony prominence above the eye sockets. This structure not only gives the face a stronger, more masculine look, but also makes the distance between the eyebrows and the eyes narrower. That's why men's eyebrow usually appears lower than women's. The brownish is part of the forehead bone, which naturally contains an air cavity inside called the frontal sinus. The size and shape of this frontal sinus vary from person to person, and we can see those differences clearly on X-ray or CT scans. The surgical technique for brownish reduction, also known as brownish bone contouring, can be classified into three main types. The selection depends mainly on the size of the frontal sinus. The first type, called C1, involves simply burring down the thickness of the brow bone. This method is used for patients who do not have a frontal sinus, which is quite rare. The second type, called C2, combines bone burring with depressing the most prominent area inward. The part that press in is then reinforced with tightened mesh to keep the bone strong. This technique is used for patients who have a small sinus and only a mildly protruding brownish. The third type, called C3, is used for most patients who have a large frontal sinus and a very prominent brownish. This method is known as the frontal sinus setback. The process can be summarized in three simple steps. First, the protruding front wall of the frontal sinus is completely removed. Second, the height of the surrounding bone is reduced to the desired level, and the sinus lining inside will shrink accordingly. Third, a new wall of the sinus is reconstructed using titanium mesh, which is fixed in place with titanium screws. The titanium mesh is as strong as the original bone and is fully compatible with the human body, so it can stay permanently without any long-term side effect. By using the proper technique for each patient, this surgery can reshape the forehead into a smoother and rounder contour, making the face appear softer with a greater distance between the eyes and the eyebrows, and completely transforming the appearance from masculine to feminine. Brow bone reduction is often performed together with a brow lift in patients with low eyebrows or with scalp advancement, also known as hairline lowering, in patients who have a high hairline. I explain more about the brow lift and scalp advancement procedures in my next video. Please stay tuned.